So am I. I was pleased to see on the back of any number of T-shirts one of my favorite Dr. Martin Luther King quotes. He said that in all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And I know all of you understand that, and I know President Barack Obama understands that. President Obama has said we should build upon that which is working. Medicare is working, President Obama. Since 1965, poverty among those over 65 has been reduced by 60%. Thank you, Medicare. And we know that Medicare, unlike the private insurers, actually contains costs. And I know that President Obama's greatest intent here, because he has said we cannot repair our nation's economy until we contain the cost of health care. And why is that? That's because the cost of health care is increasing annually 4 times the rate of the economy. And how do we pay in our public programs for health care? But with tax dollars. And tax dollars are directly related to the growth of the economy. But health care is growing 4 times faster than those tax dollars. This is an equation for failure. It only gets worse and worse until we get rid of the middleman. You know, we don't have a health care system in this country. We have a risk management system. And the risk that is being managed is not the health and well-being of you or your family or our communities. The risk that is being managed is the profit margin of the insurance industry, which provides no health care. Bernie Sanders was right. This is just craziness. Why would you put a for-profit middleman in between the patient consumer and the health provider? Because the responsibility of this for-profit middleman is not our health. It's to their board of directors. They have a fiduciary responsibility to increase the profit margin. Our health is their business, not their concern. And that's Lily Tomlin's line. I got to credit her for that. Thank you, Lily. Let me tell you what we're doing in California. We're the only state legislature in the country which has placed a single-payer universal health care reform bill on our governor's desk. We've done that twice. Thank you, Senator Sheila Kuehl, for leading the charge of the California Nurses Association, the California School Employees Association, the California Teachers Association, all the labor organizations who have supported us in that effort. But Arnold Schwarzenegger didn't quite understand what we were doing. And I know that because when I read his veto message that says I cannot sign this because it is socialized medicine, I know the governor is in need of some education. This is a public-private partnership, Governor. You love private partnerships. This is publicly funded, privately provided health care. Your doctor doesn't change, your hospital doesn't change, your clinic does not change. And we're doing this